Hello, welcome. This video is about acetaminophen toxicity. Acetaminophen is commonly used over-the-counter medicine for pain and fever control in most countries. Though it is safe when taken at recommended doses, but when taken at higher doses, it can cause significant damage to liver and can lead to liver failure. Four grams of acetaminophen in a 24-hour period is the maximum recommended dose. At 7.5 to 10 grams of single ingestion, acetaminophen toxicity might occur depending on other clinical factors. With ingestion of greater than 10 grams of acetaminophen, the risk of toxicity increases, and at 15 grams, acetaminophen toxicity is most likely to happen. Acetaminophen, when ingested, reaches gastrointestinal tract and gets absorbed completely. Then it reaches liver, where most of it gets metabolized to sulfate and glucuronide conjugates. Minimal amount of acetaminophen with the help of cytochrome P450 gets metabolized to NAPQI, which is toxic to liver. At therapeutic doses, this is metabolized to non-toxic substances by hepatic glutathione. All this happens at therapeutic doses. Now please watch what happens at toxic doses. This guy took 20 grams of acetaminophen and is wondering what's going to happen to him. On day 1, patients can be asymptomatic, but nausea, vomiting and diaphoresis can occur. Between 1 to 3 days, initial symptoms resolve, AST and ALT levels rise, there will be right upper quadrant pain, increased PT and total bilirubin can occur, and there can be oliguria and deranged renal function. Between 3 to 4 days, patients can develop hypoglycemia, AST and ALT levels peak, there can be jaundice, hepatic encephalopathy with increased ammonia can occur. Patients can also develop acute renal failure due to ATN. Death can occur during this stage. After 4 days, if the patient survives, recovery phase begins. Labs take several weeks to come back to normal. Complete recovery without chronic sequelae is expected. This guy took high doses of acetaminophen at 3 p.m. Acetaminophen levels should be checked after 4 hours after single acute ingestion. So in this case, it would be 7 p.m. Treatment should be initiated if acetaminophen level is above the treatment line in modified Rimac-Matthew treatment nomogram. Activated charcoal can be given up to 4 hours after taking acetaminophen, and it should not be given in patients who are unresponsive. N-acetylcysteine is the antidote for acetaminophen toxicity. It should be given if acetaminophen level is above the treatment line in nomogram after 4 hours after acute ingestion. NAC also should be given if time of ingestion is not known while awaiting for lab results, and it should be continued if on labs acetaminophen concentration is high or if there is liver injury. It also needs to be started if lab results are going to be delayed for more than 8 hours after ingestion, as it is beneficial to start NAC within 8 hours after ingestion. NAC should be started with the history of high doses of acetaminophen ingestion and there is liver injury on labs. NAC can be given orally and it is given for 72 hours, commonly used in US. It also can be given intravenously for 20 hours, commonly used in UK. IV treatment is also used if oral NAC is contraindicated. Look at acetaminophen level. It should be 0 or near 0 before NAC is stopped. ALT level should be significantly coming down, and clinical condition should also be improving apart from the numbers alone. And finally, INR should be less than 2. If patient goes into fulminant hepatic failure, then NAC should be continued until patient improves or until patient gets liver transplant if patient is in the transplant list. During this stage, serum bicarbonate and creatinine along with LFTs and INR should be frequently monitored. And thank you for watching this video.